and joining me now for the latest on COVID-19 in the City of Cornwall and area is our Medical Officer of Health, Dr. Paul Roumeliotis. Welcome back, Doctor.
Good to be back.
Now, so we've seen in the City of Cornwall, we had basically flattened the curve. We hadn't seen any new cases for almost 2 weeks, but now a healthcare worker has tested positive right here in the city. We'll start with that.
Yes, we, as part of our routine testing, we tested all of our long-term care facilities, including the ones in Cornwall, and this specifically is St. Joseph's. And that we tested that home last week, and over the weekend we got the results. The good news is that there were no residents that had any positive tests, and we had one individual, one worker who was positive. Again, no symptoms, and that individual was wearing the appropriate protective equipment while working at the establishment. So we followed up with our partners, at the long-term care facility. We know the staff very well. We know the infection control nurse over there. Everything was in order in terms of making sure that there was no spread or potential for spread. Any gap or any little hole was plugged in terms of any ability for the virus to sneak through. And so we're very confident that the proper precautions are in place, and we feel confident that at this point, and that no other resident has tested positive, and we hope it continues that way, and nobody has any symptoms either.
And of course, fingers crossed that remains the case. Now, of course, any case within a long-term care home, even if it's just one, does constitute an outbreak when we're talking about statistics. The other outbreak that would be in our viewing area was at the Woodland Villa in Long Sault, and that one's nearing its course and seems to be well on its way to being resolved.
That's right, and that again, nobody had symptoms, and at that point of testing, and it seems to be resolving, and we'll just follow it up. Again, we're taking the necessary precautions, working with the institution to ensure that they have the proper protection in place, and so I think that's under control. And that makes for our three, including Pinecrest. And one of the things I just wanted to say is that for the Cornwall area, yes, you see we were flat in terms of stuck at the 14 number. We're up to 15, which goes to show you that we still have potential activity in our area.
Absolutely, and that indicates that, just as you alluded to, that there's still some community spread. It's somewhere, so maybe a chance to remind the viewers that even as restrictions are slowly being lifted, we're seeing more businesses able to operate. We're seeing parks opening for biking and walking, but the importance of protecting oneself and social distancing.
Exactly. What we're trying to do is we're trying to ensure that we're balancing between ability to go out and get some fresh air and open up a bit, open up society a bit, but at the same time keeping a very close eye on those numbers, hoping that they still remain flat in our area. And the only way that they're going to remain flat in that area as we open up is that people should adhere to washing their hands, social and physical distancing, abiding to rules when they go to stores, not going out when they're sick. Very important measures to keep going, and these measures will keep on going because those are going to be the conditions with which we will continue to reopen businesses and other activities over the next few weeks and months ahead.
And when we talk about people exhibiting symptoms or who are sick, obviously the first thing is to stay home. But we know that the testing center has administered, I believe in Cornwall, over 800 tests now. We know the focus was on long-term care, which are not part of those numbers. But let maybe a reminder viewers as well that if they do have symptoms and they do feel that they should be tested, what they should do.
Yes, first of all, right now we're still testing individuals, prioritizing individuals who are working in essential services, essential businesses, people who have been in contact with others, or people living with people who are working in essential services. Everybody, those people who have symptoms, obviously hospitalized individuals, people with chronic medical conditions. However, stay tuned over the next couple of days. Once we finish our long-term care facilities, and as we start opening up more and more businesses and activities, we will be opening it up to anybody with any symptoms that can go and get tested as we move forward. So stay tuned.
And we'll make sure to keep an eye on that as well. And on that note, Doctor, thank you so much for joining me for this update, and best of luck until the next one.
No problem.